Why is haptic feedback essential for surgical robots? Imagine trying to thread a needle while blindfolded. Now, think about doing that inside a human body with no way to feel what you're touching. That's what surgery without haptic feedback can feel like. Surgical robots are incredible tools that let surgeons perform complex procedures through tiny cuts, but they often lack the sense of touch. This is where haptic feedback comes in. It is technology that gives surgeons the sensation of touch during robot-assisted surgeries. When a surgeon uses a robotic arm, they control tiny instruments inside the patient. Without haptic feedback, they're relying only on visual cues, which can be tricky. They can't feel if they are gripping too hard or if the tissue is fragile. This can lead to accidental damage or less precise movements. Haptic feedback restores that sense of touch by sending real-time force and texture information back to the surgeon. It helps them feel resistance when they touch tissue, whether it is soft or hard. This tactile information allows for more delicate handling of tissues, reducing the chance of injury. It also helps surgeons apply just the right amount of force, which is especially important in surgeries involving nerves or blood vessels. Studies show that with haptic feedback, surgeons apply less force overall, which means less trauma to tissues. It also improves accuracy, making surgeries safer and more successful. Procedures like brain surgery, heart operations, or microsurgeries benefit greatly from this technology. For example, in neurosurgery, feeling the difference between healthy and diseased tissue is vital. Haptic feedback makes it possible to distinguish these tissues more easily. It also shortens the learning curve for new surgeons, as they can train with more realistic sensations. Overall, haptic feedback transforms surgical robots from simple mechanical tools into extensions of the surgeon's own hands. It makes procedures safer, more precise, and more comfortable for patients. As robotic surgery advances, integrating haptic feedback will become standard, helping surgeons perform at their very best.